Wipes up.
Car score down.
It's good practice for Santa Maria Comelin,
There we go.
right?
Let's get it trending. You know, I have seen the hashtag. Like the kids on Twitter are really starting to use this right now. So,
Oh yeah.
thank you, young people, for doing that, and stay in school. By the way, you know, you guys are on the clock.
Stay in school.
Yeah.
919.
Hey, Janella's doing it too. Thank you, Janella.
There you go.
There. Hey, all right, everyone, long distance in Zoom. Wipes up, car score down.
It's 919.
It's a thing now.
It is officially. This is the link on the Breeze 93.9. Let's go to the Zoom room where we have environmental health officer Remaliza Oriondo of Public Health, and she's joined by the spokesperson for the department, Janella Carrera. Good morning, ladies.
Good morning.
Morning, Chris and Bree.
Good morning.
So we wanted to bring you on just to kind of catch up on some of these inspections that we're doing with the Division of Environmental Health. Inspections I know they're doing the regular, food safety type inspections, and there are also these COVID-19 inspections, right? So I guess if either of you could just talk about what goes into a COVID-19 inspection and what things the inspectors look for when they show up to a business establishment to do a COVID-19 inspection. Unmute. There
So,
you go.
Chris, what we usually do for our inspections, of course, you mentioned that we're also doing our regular inspections for the health regulated establishments. And with that, we also conduct our COVID-19 inspections, wherein we make sure that establishments and other businesses are following the public health guidances and the executive orders. So, we look for if they have signages to remind their patrons to wear masks prior to entering, making sure that they maintain social distancing. We also, talk to the establishments and their management to make sure that they do have a COVID-19 prevention and mitigation plan, just so we know that these businesses are proactive in preventing COVID-19 from spreading within their establishments.
One thing I have noticed, because I get some of the reports, and based on the last inspection report that I received from the 9th through the 15th, a lot of them failed to post appropriate signage for face masks and social distancing. But the other one here is, and I think you just mentioned it, failed to have and present an organization-specific guidance plan in place. Is that a common thing you guys are seeing?
It's one of the most, frequent cited COVID-19 violation, that the organization or the business does not have a COVID-19 plan in place. So sometimes we come in, and it's a great opportunity to help the businesses and their employees in educating them with regards to helping them prevent contracting or spreading COVID-19 while they're working.
And so for all businesses, is that what they're required to have?
Yes, I believe during the announcement of PCOR 2, PCOR 3, and again with PCOR 1 in August, there was an announcement that said that all businesses that are going to resume operations should have a organization-specific plan in place and submit it to public health. So these business plans are actually made available to the public on the public health website.
And I guess because it is so common, like you were saying, is there something that you guys are doing to reach out to these businesses, or working with the Chamber or Guam GHRA?
Yes, I believe if you go to the public health website, there are samples provided by the Guam Chamber of Commerce. And also when we do our site inspections, we provide them with the guidances wherein they can it can help guide them in developing their organization-specific plans.
I think
the other thing too that I want. Sorry, the other thing too that I wanted to add is, when we go out and we visit these establishments and businesses, and we see that they don't have their organization-specific plan, we do work with them. So it's not meant to punish them. It's really something that where we give them that opportunity to correct that violation. So, and a lot of times they are very they do cooperate, and they'll submit it because they want to remain open. They want to cooperate with us. And we work with the chamber. We work with, for example, GHRA. GHRA has actually been a really great partner. So they'll work with their their organization, the members within their organization, to help them and guide them on how to create that organization-specific plan, and so that they can submit it and, of course, be in compliance with them, with the guidances established by public health.
Have you ever had to shut down any businesses for COVID violations?
So currently, we are still in the process of finalizing the processing and implementation of the COVID-19 enforcement regulations.
Oh.
So far, we are not closing any establishments for COVID-19 violations. It's more of an assessment to ensure that they are following the executive orders and the public health guidances.
You know, it's and I don't know, I guess it would fall on the business, but let's say you're dining out, you wear your mask. We've gone over this with different people from environmental health, but you wear your mask all the way to your table, you sit down, right, then you can remove the mask. But what I hear about is customers who are also dining out, who see somebody they know, and they get up from their table, no mask, and go over and try and hug people, kiss people. Whose responsibility is it to enforce those types of infractions? That falls on the business, right? Or
That's right. Yeah, you're right, Chris. Yeah. So the enforcement, absent public health or any other enforcing authority being present when those things happen, really it would fall on the establishment to enforce those rules and those directives. It's really upon the establishment to ensure that the policies, especially the organization-specific policies that they establish within their own organization, are being followed. And that's why it's really important that restaurants, retail establishments, businesses have those in place, because they should be enforcing them when they write those policies. So when you see, like you mentioned as an example, if there are patrons who are going from table to table, they really should be the ones going in there and saying, hey, you really shouldn't be doing that. You should stay within your own table. Or for example, the limit is 6 chairs per table. You might see somebody, going to another table and there may be 7. The restaurant should be advising their patrons, you can't be doing this, or, you got to put your mask back on after you're done eating. It's really on the establishment to enforce those rules. And if we receive a complaint, if environmental health receives a complaint and we go out and inspect, a lot of times when we get there, we don't see the violation occurring. And at that point, there's not really much we can do. We base our inspection and our observations on what we can see. So it's really difficult to sort of weigh and manage what we write down on our inspection reports.
yeah.
When the inspectors go out and they do say their sanitary inspections, are they also able to do these COVID-19 inspections to ensure they have the organizational plan, or are they done separately?
We've been actually conducting both inspections at the same time.
Okay.
We usually go out in teams of 2. So there's one inspector that does the sanitation inspection, and then another one is there to observe any COVID-19 violations and conduct the COVID-19 inspection.
Okay. And where are you guys with staffing? I want to say that when Tom Nadeau was on a while back, there were efforts to hire.
So over the last fiscal year, we actually lost some employees due to promotions or relocation or just extended leave due to medical reasons. So currently there are 5 inspectors that are able to go out in the field and conduct these inspections.
Are you guys going to be hiring more people, or is that something that you're hearing, considering that, I mean, it seems like your responsibilities have increased with this pandemic?
So that's a good question. I believe we are in the process of looking into hiring more people. We did get 2 new environmental public health officers. They are still in training, but they were also assigned COVID-19 responsibilities. Therefore, they were assigned to another COVID-19 section.
Right. Yeah, and I think, just if you could just kind of explain a little bit to our viewers that we're not just talking about inspections of restaurants, but you guys do other sorts of inspections. If you wanted to kind of explain just all of the responsibilities, so people don't think that they just do inspections for restaurants and daycares.
So you're correct. We don't just do the food establishments. We also inspect like the child care centers. We still get complaints about non-health regulated establishments. So this could be offices, other professional services, construction companies, which are not permitted by public health, but because of the COVID-19 directives, we do oversee them to make sure that they're still following the executive orders and the public health guidances. So we oversee about, I believe if I'm not mistaken, 2,000 establishments, and that is divided into 5 field inspectors right now.
Yeah, that's a lot of work.
Yeah.
Yeah, those are only the health regulated establishments. So that doesn't include the non-health regulated establishments or the public and private premises.
Would you say that short of the industry specific plans that the businesses are kind of getting, they get it now, what they have to do for COVID, what they have to do sanitation wise?
So a lot of the businesses, majority of them, they're very cooperative. And when we come in, we want to remind the businesses and the public that we're not there to just cite or say that they're violating, but we're also there to, mostly we're there to help educate them, and we're there to promote health, because we want to prevent the spread of this disease in any establishment and in our community. So when we come in and we explain to them the reason why they need a organization specific plan, they start to understand that, yes, I don't want to bring the disease home. Okay, it's important for me to make sure that I implement the wearing of masks to my employees. It's important for me to make sure that I screen my employees and my customers before they come in, and that we social distance and we disinfect. So they are realizing the importance of these plans.
Mm-hmm. And since you guys really are on the front line in terms of ensuring our businesses, our food establishments are meeting certain public health guidelines, one would think that you might be experiencing also a serious backlog. Is that the case?
You mean backlog with our
Inspections?
regular?
Yeah.
Yeah. Yes, we have been experiencing. So, of course, our inspectors are trying to complete our day-to-day tasks, which are our inspections and our other administrative responsibilities, which is why we have extended hours of our operation. So some of us actually work until 10 p.m. Some of us have been working over the weekends and holidays.
I want to add that, Ramalisa is actually being very, very humble here, but our environmental health inspectors, our Division of Environmental Health has been non-stop. I mean, in addition to our health, our nurses, environmental health has been working 24 hours, nonstop every day, holidays, weekends. You know, sometimes I'm on a call with them, 10 p.m. at night. They've just been nonstop doing health inspections. If there's a complaint and it comes in late at night, they are out there doing inspections just to ensure that, you know, people are in compliance, businesses are in compliance. So I just want to, you know, my hat's off to them as well. You know, we put a lot of, we give a lot of respect and kudos to our nurses, but our environmental health team is also working around the clock. So I just, you know, Ramalisa, to the environmental health team, I just want to commend them too for their hard work as well.
Right. Thank you. Thank you guys for all that you're doing. We know that you're understaffed, and it's not just during the pandemic. I think you guys have been understaffed for a long time. Right. So,
if you could, because I ate out once. I want to say it was in July, but for those people who are dining out now, with the dining out side being an option, what is the protocol? Because I remember when I ate out, no one at the restaurant said, hey, this is what you do. This is what you're going to do. You go sit over here, then you can do this and do that, take your mask off. So I know that we had said it would fall upon the business to enforce some of these protocols, but just for the customers out there, what exactly is the protocol for outdoor dining at a restaurant?
So on our public health guidance memo number 2020-041, we did define outdoor dining as an area wherein, you know, it could be covered, it has an overhead cover, and shouldn't have more than 2 walls. Another thing is that tables and chairs should be spaced out to ensure that customers or each party is separated 6 feet apart. All customers and employees should wear their masks, and customers are only allowed to remove their mask when they're eating or drinking. And of course, every time they're going to talk to, let's say they're eating, right? They don't have their mask on and they call a server, they still have to put on their mask when they start talking to the server. Another thing, like what you said, when they start mingling, we do remind the establishments, especially the food establishments who are doing outdoor dining, that if they see tables that are starting to mix or commingle or start gathering, they are responsible to ensuring that they enforce that 6 feet distancing and making sure that each table is limited to only 5 people.
Okay.
Well, thank you guys for coming on. I really appreciate your time.
Yeah. Janella, you want to give us anything else on the public health side before we let you go?
You know, we're really hoping to get the enforcement rules out as soon as possible. We are working on it. It's being finalized. We were really hoping to get it in time for Thanksgiving. It's still a goal, but, you know, hopefully soon we will get it out. And I'm not really sure how it's going to look, but hopefully it'll be out soon. But other than that, you know, we just want to wish everybody a safe Thanksgiving. Again, just a reminder, you know, 5 is still the limit. Be safe out there. And I know Black Friday is coming up. That's another reminder for everybody to please, you know, be safe. Try not to, if you can avoid the lines, please just shop online or do curbside shopping.
All right.
Black Friday, what's that?
I know.
Anybody got time for that?
Thank you, guys.
Thank you, Janella. Okay.
Stay safe.
Thank you, Ramalisa.
Happy Thanksgiving.
You
Happy
too, guys.
Thanksgiving.
Be safe. Oh, wait. Wipes up, guys.
Wipes up. Car score down.
What's up?
Right on. Okay, here we go. Watch it drop. All right. Thank you, ladies. We'll take a quick break, and we're back with more of The Link on the Breeze, 93.9